Capitol Report is a production of Senate Media Services.
On this week's program, we'll look into the Senate's debate surrounding health care insurance relief and reform in the individual market. We'll also learn about Governor Dayton's 2017 tax proposal. Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Lurkey. Senate committees were busy this week at the Capitol taking up Senate File 1, which would provide health care insurance premium relief for Minnesotans in the individual market.
Senate File 1 is in response to something that we all have talked about over the past several months. In July, Blue Cross Blue Shield left the individual market, and we all knew at that time there was something wrong with our individual market. Many of us expressed shock at premium increases of 50 to 67% as they were announced this fall. Our friends, neighbors, local business owners, and even family members told us of the worry they felt paying their insurance premiums or having to choose not to pay their mortgage. As these rates have increased, more people have enrolled in MNsure. They announced that they broke 100,000 in their latest enrollment measurement. Those individuals have access to advanced premium tax credits. However, there's a large category of people who are not eligible for advanced premium tax credits. They are impacted, their businesses are damaged, and there's no relief available. In October, Governor Dayton proposed just over $300 million in premium relief for the individuals in the middle of this market. Many of us supported that, but for reasons beyond this committee's time, the plans did not move forward this fall. We do have a general agreement to help, but most Minnesotans expect that if we're going to spend $300 million, we should address some of the underlying problems in this market. I've defined 4 problems: premium increases, unexpectedly narrowed networks, uncertainty in the individual market, and a lack of options in Greater Minnesota. We are proposing some recommendations to alleviate the pain of each of these problems. Nearly $300 million for premium relief, continuity of care funded in this bill, reinsurance, which will be part of the A6 amendment to alleviate some of the uncertainty in the market, and small employer reforms, including MEWAs, that will be addressed in the A6 amendment to address the lack of options in Greater Minnesota.
Some Minnesotans expressed their concerns during public testimony.
On my livestock farm, I have a farrowing operation. Right now, I have someone who's doing my chores at home, and I have sows farrowing pigs. If they're not taken care of right now, I lose those pigs, I lose the income. And that's kind of what we're facing with farmers and rural people out there. We need to get that relief out there right now so people know where they are.
And what I've been hearing, I was over in the House area earlier today, is that there's basically 2 things going on here. One, relief for individuals, and the other is reform. And I would hope that you will not throw the relief out because you can't do the reform.
Joining me in the studio is the author of Senate File 1 and chair of the Health and Human Services Finance and Policy Committee, Senator Michelle Benson. Welcome.
Good morning. Glad to be here.
In public testimony this week, a farmer said he would hope that you would not throw out the relief if you were unable to reach agreement on reform. What do you say to those who are concerned that the relief won't come because of holdups in the reform part?
Well, as we heard Commissioner Rothman say, he has been working on stabilizing the individual market since October of 2015, and so we look forward to seeing the proposals that he and his team have been working on. I think we can come to reform agreement with the relief. What people need to know is that if we don't act quickly on reform as well as relief, we can't impact the market for 2018 because the products for the 2018 market are actually being developed. Some of them now, but many will be developed in March, April, and then submitted to Commerce in May. And so we're trying to do 2 things very quickly, and we look forward to working with the governor and his team of people on finding the right answer.
The Republican plan would put caps on relief after 3 months for those who are above a certain income threshold. MMB Commissioner Myron Franz said that this creates a number of problems for his department because they would be issuing checks, that his office is not set up to handle residency and income verification, and possibly instituting this capability would take time, cost money, and increase chances of fraud. So what do you say to that?
We're working with the commissioner. We took out residency verification because the plans are required to do residency verification, and we changed the interactivity with the Department of Revenue for income verification. And so we're working very hard on meeting the commissioner's needs while still understanding that some means testing, I think, is a reasonable provision for us to consider.
So let's talk about the reform aspects of the bill.
Yes.
You had said that you were going to try to do something with reinsurance, and how would reinsurance alleviate the uncertainty in the market?
There are a few very expensive patients in the individual market, and the plans that build these insurance products don't know exactly what insurance product those individuals will enroll in, and so they have to assume that expensive people are going to come into almost each and every plan. So if we take a little reinsurance for somebody who's going to cost more than $70,000, the insurance companies then co-pay up to $250,000 so that the insurers and providers can work on containing cost for those who need the most care and are the most expensive without having to build it into every single product. And we're hoping that's how reinsurance will impact the market.
So it kind of creates a pool that people can draw on for these very expensive cases.
And it's not a pool that we put people into, but it is on a claim basis so that we're not stigmatizing anybody. If you need the care, you get the care, but the insurance providers have sort of a relief valve if costs get very out of control.
You have also said that your plan would help those with acute illness receive continuing care through their doctor. We've heard stories of some people, not cancer patients, losing their doctors. How would this work?
So if you have a plan terminated, either because they're no longer offering product in the market, so a Blue Cross customer, or because they're no longer offering in your particular county, then you would be able to go to a new plan but keep your old provider for 120 days, and the state would pay the difference in cost if your old provider didn't accept the new plan's payment rates. It all gets really complicated, but when it comes down to it, what we're saying is we understand there are acute, serious cases of both physical and mental illness, and we want to give a 3-month smooth transition so you become comfortable in the new provider system. And if you're in the last 6 months of your life, we're going to leave you in your old provider system so that you get that continuity and familiarity in those last critical 6 months.
Can you explain the reforms focused towards employers and small businesses to provide options for their employees? And I've heard MEWAs thrown around, and I don't know if this relates or not. If you could talk a little bit about that.
What we've done, several provisions. There's a new federal law called a defined contribution plan. We've got conforming language for that so that if an employer doesn't want to have to shop for insurance for their employees and become a benefits manager, they can contribute money to an account, and those individual employees can go buy insurance that meets their family's needs. Secondly, we're lowering something called the stop loss provision, so nerdy insurance talk, but it allows employers to reinsure at a different level than they currently can so that they can have more flexibility in the health plan options they offer their employees, hopefully lowering the cost for those small employers and letting more employers offer better benefits so they can compete with the larger corporations here in Minnesota, frankly, and attract the talent that they need. And then you refer to MEWAs. We have a small MEWA provision in this bill, and it's important, but it only impacts one part of greater Minnesota's economy primarily. Our agricultural co-ops have been long-standing stable groups, and they would be able to form a large insurance pool that would have more flexibility than individual farmers buying on their own. And so we're hoping to help out the folks in greater Minnesota, small businesses in greater Minnesota and the metro, hire the talent they want, have easier benefit plan administration. So small steps. These are just the beginning of what needs to be done, but we want to take serious small steps going forward, and we hope that we can get the governor to come on board with some of our ideas. We look forward to the weeks to come.
Can you gauge your, I want to gauge your confidence level. Open enrollment closes January 31st. Do you think something will be in place by then?
We are moving this process so quickly, and some people are very frustrated at how quickly we're moving this. But like a disaster, you know, if we had 250,000 Minnesotans with their basements flooded, we would be moving even faster than this. We don't want to just hand them a check to fix the basement. We want to make sure that the cause of the flooding is also taken care of. So we're trying to do two things in a very fast, thoughtful manner with as much transparency as we can in a short period of time. We're going to do everything we can to get the governor talking with us.
Senator Benson, I know how busy you are. Thank you so much for
I'm
coming.
so grateful for your invitation. Have a good day.
And to offer the DFL perspective on healthcare policy is the ranking minority member of the Health and Human Services Finance and Policy Committee, Senator Tony Laurie. Welcome.
Thank you for having me.
Not long ago, I heard Senator Bach talk about how Health and Human Services became aware of some of the problems that we're facing now, particularly in the individual insurance market last year. What kinds of reforms could have been done then, if it had been possible, to address the withdrawal of insurance companies, the narrowing of networks, and the skyrocketing premiums?
Yeah, you know, this is an issue that we have been working on for quite some time. And, you know, in the interim ahead of last session, we pulled the A-team of the healthcare community. Hospitals, doctors, clinics, consumer advocates, mental health advocates, legislators from both sides of the aisle, health carriers, 29 members together, and spent hundreds of hours in the healthcare financing task force. And in the Senate, we carried almost, I think, every one of the recommendations that came out of that task force with 80% support into conference committee, where each and every one of them, you know, failed. You know, some of the things that we did try last year, the tax credits for people that aren't eligible for the advanced premium tax credits available through the feds to help subsidize. This is something that we recognized and introduced right at the beginning of last session and weren't able to get traction on. I think that one is very similar to what we're talking about now and works with the federal construct to try to move us forward and help make sure that, again, we have access to affordable and quality health care for each and every Minnesotan is what we continue to try to get it back to. Another really critical reform that I think we were working on very hard and we should continue to look at is, you know, as the individual market, that private model begins to unravel, particularly in greater Minnesota, we should be looking at trying to make Minnesota Care available to consumers out in particularly greater Minnesota, where some of the access issues and some of the rate increases are the steepest.
Well, let's talk for a moment about Senate File 1. House File 1 is moving through the House. Senate File 1 is now moving through the Senate. This legislation would provide emergency premium relief, among other things. Hearings have started. What are your thoughts on this particular legislation?
So, I mean, I think there was two articles of the bill, and it's that, amongst other things, is where we're having some issues. You know, I think that you know, the governor and the DFL Senate have been for 2.5 months now saying we need to do that immediate premium relief. We tried to do it during a special session. That was, you know, it didn't come about for a host of reasons. That premium relief is something that we could do even yet today, if we had the will to get it out of the chamber clean and make sure that we have a 2017 marketplace that has that additional stability so that we can then begin to talk about what the 2018 market and beyond looks like. It is certainly the case that we need some market stability measures, and we should act with all due diligence on those, but those are issues that need a bit more vetting, need a little bit more work, a little bit more transparency, some time to actually get the fiscal notes and have some assumptions around how they function. And those are things that the answers to which we just don't have today. And so there's this whole set of really significant changes to the entire fabric of what healthcare in Minnesota looks like that just don't have any of these assumptions borne out.
So your preference is still to do the premium relief as
Yes.
standalone, and then
Yes.
really work hard on these other reform areas.
Right.
What types of reform, more specifically, would you like to see? If you could have it done the way that you wanted, how would you reform the narrowing of the networks and the continuity of care?
Yeah, well, I mean, I honestly do think that looking to our public programs and how they function, you know, honestly, in the metro area, there is great competition amongst providers, amongst carriers, and you know, their individual market is much less volatile than in greater Minnesota. That's where most of this, particularly with the networks, I mean, because you have very few providers out there, and if you cut out one or two providers, I mean, you're really disrupting a lot of care for people. I think that making Minnesota Care as an option, at least in areas where there is lack of competition or where there are premium spikes that rise to a certain level. I mean, I'm willing to offer it statewide, but make that public program offering available on a much broader scale could bring an additional choice to consumers and some additional competition for our private sector actors.
I've heard the Republicans say that for these greater Minnesota areas where there's a lack of competition, one way to increase that would be to bring in for-profit HMOs and some cross-state insurance company type things. What is the rationale for being opposed to that, if you are opposed?
Well, we certainly can have some meaningful discussions about what that would look like. And within the context of the consumer protections embedded in the Affordable Care Act, guaranteed issue, you know, kids to age 26, things that, you know, are really widely valued across the population that are in question. You know, if we allow for multi-state actors, the typical trajectory of that is to offer very skinny plans, particularly.
So it's essentially catastrophic care?
Well,
is that what you mean?
yes,
Okay.
and it would peel the healthy populations out of an already unstable market, actually creating even steeper premium increases for those left in that market that need a broader set of coverage options for age or health status, something like that. Those are some of the concerns. You know, within the context of the consumer protections that exist today, you know, maybe it's not that big a deal, but are we going to put those consumer protections in some way, in a, you know, in an environment of such uncertainty at the federal level? I am a bit reluctant to just say, well, whatever the floor is at the federal level, any actor in a state that has a much different insurance marketplace than Minnesota, that what they're able to put together would be good for Minnesotans. Minnesota, what needs to be kept in mind always is that we have achieved 96% coverage in Minnesota. That's the lowest uninsured rate we've ever had, and we are consistently in the top 5 for the healthiest states in the country. That's not by accident, it's by design. And some of these issues that we have embedded in the fabric of our healthcare system, you know, at least need to be discussed a great deal more and understood a great deal more than one day of 6 hearings across the House and the Senate provides the healthcare community, consumers, legislators, the ability to weigh in and understand what it is we're doing and make good and rational choices to provide the stability that we all agree we need to work on.
Senator Laurie, I want to thank you so much for your time today.
Absolutely. Well, thank you for having me.
The urgency of enacting health care insurance relief was noted during debate on the Senate floor.
Do I think that they want to have this relief right now and the heck with the solution? I don't think so. I think they want us to fix this. We're not talking, we've got people from families of 4 from 25,000 to 100,000. They're covered through MA, Medicare, and the exchange. I think people are sick and tired of Band-Aids, and this bill addresses all 3 pieces of this 3-legged stool. It's relief, it's reform, and it's access. And it's not perfect, but I'm not going to stand here and let better be the enemy of good and do nothing.
The bill before us is just not ready. In fact, it's really harmful to Minnesotans across the state. There's time to do it right. We had an opportunity with Senator Lori's amendments to do it right. They've been on the table essentially since October. There's already the delay. People have already had to front their premiums for January, and at this rate, for February as well, because the majority refused to decouple long-term significant reform in the market from the immediate relief that our people are waiting for. That's why we're in this position now.
A bipartisan tax bill easily passed both chambers last year, but was never signed into law due to a $100 million wording error. Governor Dayton welcomed the 17th session by proposing new bonding and tax bills. Joining me in the studio is Department of Revenue Commissioner Cynthia Bowerly. Welcome.
Thank you for having me.
The cost of the governor's tax proposal is $300 million. Are the tax reductions that he's proposed permanent? And if so, can the state afford it?
Yes, the governor has always been focused on maintaining the budget stability, and so of course whenever we're looking at tax relief, those are ongoing costs to the state, if you will. And so this bill does provide over $300 million in tax relief and in aids to local governments to provide essential services. And those costs are then netted against some of the revenue raised that by closing some of the loopholes. And so the total cost of the bill for the biennium is about $185 million. And those tax relief provisions are ongoing. They would continue into future years. We are just looking at these two biennial sets of numbers at this point in time, given where we are in the budget. But they would be continuing tax relief for Minnesota families.
Well, and you mentioned it already that the governor's devoted to maintaining a sound budget, and he said that this bill provides, quote, provides assistance to those who need it most while protecting the progress we have made to stabilize our state's finances. In the governor's view, who needs this tax relief?
The governor has focused his tax bill and the relief provisions in it on Minnesota families. So the centerpiece of the bill are a couple of provisions that help families put more money in their pockets so they have more money to spend on their needs. For example, the working family credit is going to help a lot of families in Minnesota, families with incomes up to $48,000 receive a refundable tax credit. And across Minnesota, you know, that's right in the range of the median income for some of our counties in Minnesota. So many families across the state will be able to take advantage of this. In fact, almost 100,000 more families in Minnesota will be able to take this credit. The second piece that's really focused at families is the Child Independent Care Credit. This is a credit that exists in Minnesota to help families pay for important child services, child care. Which can be
very expensive.
Which very expensive in Minnesota, some of the most expensive in the country. And so recognizing that this is a cost that families, of course, want to pay for to make sure their children are safe as they go to work and are well cared for, are in a great early learning kind of environment, this is a tax credit that helps those families. That targets a little more middle class families, so incomes up starting at $77,000, that credit will start to phase out. So again, expanding this credit to 95,000 more Minnesota families than already take it, so that we can help families pay for important things like childcare.
Governor Dayton talked about eliminating loopholes and tax avoidance strategies in an effort to level the playing field. So how does that work?
Yeah, so the tax code in Minnesota provides certain tax treatment for businesses across the state in very many different industries. And what we have noticed at the department over time is that there tend to grow loopholes. So someone will figure out a way to avoid paying taxes even though they are engaged in a similar business. And the largest piece in this set of loopholes that we are proposing to close relates to foreign source income. So in Minnesota, when that income from a company who has foreign income that they're bringing back on shore, at the federal level, that is treated as taxable income. Here in Minnesota, that's given a little bit more of a preferential treatment through a dividend. And so what we're proposing in this provision is to align Minnesota's tax treatment of that foreign source income with what happens at the federal level.
Okay, and then by eliminating loopholes, like the one you just mentioned, does Minnesota risk losing businesses to other states that are perhaps viewed as being friendlier?
Mm-hmm. So there's a lot of conversation about business climate here in Minnesota. One of the things that we know is that our workforce is the biggest asset that we have for businesses here in Minnesota. They depend upon our workforce, and one of the things we need to do is make sure our businesses continue to have a great workforce. And certainly we know that tax treatment is important to businesses as well. These loopholes affect a very small number of companies, and what we're really trying to do is level the playing field for those other businesses who are fully complying with Minnesota's tax laws.
Okay. Water quality has been a priority of the governor's. He's talked about it on many occasions. Can you describe how his proposal will help farmers comply with the buffer strip requirements?
Right. Well, there's two provisions in his tax bill that address the new buffer program. One is for farmers who are going to be taking what they would otherwise have as tillable acreage out of production. And so there is a payment to them of about $40 per acre to help them with that transition. We know they're going to be taking land out of production, and so this is to help them with that. The other is aid to those local soil and water conservation districts and counties who will be helping farmers implement that. They're going to have some additional costs with this program, and so we want to make that a smooth transition for them and help support the work that there is going to be happening at that local level.
And so what other initiatives would be directed towards farmers?
So there's also a provision that helps farmers pay for the part of their property tax that is focused on the referenda that get passed at the local level to help with school buildings.
And that's been talked about quite a lot lately.
It has been. It was in the 2016 tax bill. It has been a bipartisan effort, and the governor is happy to support it to help farmers, particularly at this time when commodity prices are very low, with their tax bills. And again, we want to make sure that students in Minnesota have world-class facilities, and schools today need more technology. You know, labs now have 3D printers and machining tools so students can learn great skills to go into the workforce. Those, of course, capital buildings costs are high, and what we don't want to have happen is that the communities get divided between farmers and those who live in town because of this issue. So this provides farmers with 40% credit on their tax bill for that portion of the referenda levy for school buildings.
And finally, conforming Minnesota's tax code to the federal code has already passed the House, and it seems the prognosis is good. So if it passes the Senate as well, what does that mean for Minnesota? And the governor signs it, of course.
Yes, of course. We have encouraged both houses to move this bill quickly because we are opening tax filing season on January 23rd. That is the same day as the IRS, and it's really important for Minnesotans to be able to go ahead and file both at the same time. And many people don't think about taxes until April, but many people do file early, particularly if they've got credits coming. We're excited that the House passed the bill last week. We will be in the Senate Tax Committee tomorrow, Wednesday, and hopefully we'll be moving off the floor on Thursday. And so we will be able to make those changes that will make filing season much smoother for Minnesotans if the Senate can act this week.
Commissioner Bauerle, I want to thank you so much for your time. It's been a pleasure.
Thank you for having me.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Lurkey, and on behalf of all of us at Senate Media Services, thanks for watching.